I would just want to look at the central nervous system, and we're looking at the central nervous system based on how it can be able to contribute to the development of congenital heart diseases. Do you understand? Like when a baby is growing, the baby can have some issues with the central nervous system. Now these issues can lead to what? The baby having congenital heart defects. I don't know if you understand. So we just want to like create a link between the central nervous system and congenital heart issues. Okay. So as a way of introducing, we said that congenital heart defects, there are issues that they occur in the heart. So a baby was born with it. Okay. So when the baby was growing, development was not going on fine. So some issues came in. So there are defects present at birth, but the central nervous system plays a surprisingly intricate role in their development and outcomes. So while the central nervous system doesn't directly cause them, okay, like it can contribute. Do you understand? So how the central nervous system interacts with congenital heart, okay, development. So they have a shared embryologic pathways. So heart and brain develop simultaneously during the early gestation. Okay, like they develop alongside. They are colleagues. So disruption in neural crest cell migrations, which contribute to both cardiac and craniofacial structures, can lead to issues like DiGeorge syndrome. A lot of syndromes, and most of these syndromes, you have issues in the brain, you have issues in the heart. You get. So you can see here, issues in the brain can have issues can have impact on the heart. Then issues in the heart can have impact on the brain. Do you understand? And so is other organs too. Then also genetic syndrome. So things like trisomy 21 often includes atrioventricular septal defects, and such people, they are naturally just dull. Just permit me to say that. Okay, so they have intellectual disability. So you're having issues in the brain, you're having issues in the heart. Then 22q11.2 deletion syndrome, okay, Nonan syndrome. All of them have to do with issues in the heart, issues in the brain. Then maternal CNS-related factors. Maternal epilepsy and use of anti-epileptic drugs during pregnancy can lead to increased risks, like the side effects of the drug. But you are taking the drug to solve an issue in the brain, which was nice, but this drug had a side effect on a vulnerable person, which was the fetus. The maternal infections like rubella, cytomegalovirus, all of them can now kind of like transfer to the baby and have issues and cause issues on the heart and also the brain development. So CNS complications caused by congestive heart disease, like this one, it was not an issue from the CNS causing issues in the heart. This one, issues from the heart causing issues to the CNS. So most of the time, you know that the heart controls a whole lot of oxygen supply. So if the heart has issues, the brain is not receiving good oxygen. So there's chronic hypoxia. It could lead to stroke, it could lead to seizures. It could lead to cognitive issues. The baby is not able to recognize things. It could lead to behavioral impairment. The child is just behaving like a psyche. You understand? So the two organs, they affect each other, vice versa. You understand? So studies show that infants with congenital heart defect may have smaller brain volumes at birth compared to healthy pairs, suggesting delayed neurodevelopment from the onset. So most of them, if they have issues in the heart, they have issues with being able to speak, being able to learn a language, being able to control, do some activities. All right. Then executive function deficits, like the ability to take decisions and all of that. Okay. So this is just a link between these two systems as the baby is growing.